My name is Peter Melhado. I'm a local businessman here in Jamaica, and as a member of the private sector organization, the PSOJ, I worked in close collaboration with our Ministry of Health and Wellness to implement several software solutions aimed at optimizing the ministry's COVID-19 vaccination response. It was during this engagement that I got to know the DIVOC team, who played a seminal role in our digital vaccination card rollout. Initially, the PSOJ, through a public-private partnership with the ministry, provided support for the selection and implementation of its primary vaccination management system. UNICEF also played an important role, providing funding and professional expertise throughout the project cycle. After the platform was rolled out to vaccination sites all across the island, it became clear that the ministry would need to transition from its paper-based VaxCard system to a digital solution in order to satisfy two main use cases. One, overseas travel, and two, domestic scenarios whereby proof of vaccination was a requirement for access. The PSOJ again assisted in this process with strong support from UNICEF, who introduced several potential vendors, including DIVOC. In contrast to many of the demonstrations received, DIVOC's expertise in the subject matter was immediately apparent, particularly their deep knowledge of the environment, including emerging standards, along with their participation on key committees working on global protocols for travel. In these early discussions, I was struck by the scalability of the DIVOC platform and its track record in India, which at the time featured over 900 million records processed. At the time of the introduction, DIVOC was busy working on several projects in Asia, but were immediately receptive to the idea of helping Jamaica. Thank goodness. Apart from the software solution on offer, DIVOC assisted the PPP in climbing the learning curve on what standards to adopt, especially our choice of the DDCC protocols for data, as well as giving us their view of how the landscape would evolve going forward. Reflecting on what was achieved, it is impressive that we were able to accomplish an API integration with our vaccination management system, which allowed us to populate our certificates with already collected data, as well as to implement Jamaica's digital certificate portal, offering electronic and print options for our citizens. And all of this took just 10 weeks from start through to user testing. Quite incredible, I believe, especially in the context of an ongoing pandemic. As issues arose, as they tend to do in such circumstances, DIVOC's team were always available and solution-oriented, and we developed an extremely functional and cordial relationship that has persisted to date. There were numerous localization requests, and after analyzing them for time and benefit, qualifying accommodations were made without significant slippage in our committed timeline. The fact that this system and DIVOC's time was free to Jamaica and that the code is open source remains a great benefit to our country. Also of significant import was the credibility of DIVOC's private keys, such that we were able to make bilateral travel arrangements with other countries using these keys rather than our own public key infrastructure, which at the time was under development. With the flexibility of the DIVOC platform, our ministry is currently exploring use cases for its other vaccination programs. Given this, we expect our association to continue past this particular pandemic and feel confident that DIVOC will further enhance its platform to include even more optionality for nation-states such as Jamaica. We also offer DIVOC our congratulations for surpassing the 2 billion transaction mark. It is a stellar example of how software as a public good can make a meaningful impact on the world, not least when there is a major global public health crisis ongoing. So as we say in Jamaica, big up DIVOC and good luck in your important mission going forward. Thank you.